Welcome to AOS Institute, your destination for education on airway, facial aesthetics, and oral maxillofacial surgery. Our mission is simple: to help patients and professionals understand how the face, jaws, and airway all work together to improve health, function, and long-term wellness.
We know that many people hear outdated or incorrect information about jaw and facial surgery, but we want to provide some insight. Some providers still talk about long hospital stays, being wired shut, or surgeries that take forever.
That's just not true anymore. The procedures are much safer, more precise, and recovery is faster than most people think.
Whether you're coming to us for nasal breathing problems, crooked teeth, underbites, overbites, crossbites, sleep apnea, facial asymmetry, or cosmetic concerns, the first steps are all the same.
That's right. So your first visit starts with a detailed intake. We ask questions to understand better your medical history, your facial structure and airway, and we screen for sleep apnea using tools like stopping and our own AOS score.
We then do a complete history and physical exam, take 3D x-rays, analyze your airway, take standardized photos, and measure your teeth and face.
Based on all that, if we think there might be a problem with your sleep or breathing, we help coordinate a home sleep test.
It's a simple, small device that you wear on your finger or wrist while you sleep in your own bed, and one of our partner sleep doctors interprets the results. Home sleep tests have improved a lot. They're not as sensitive as in-lab studies, but they give us valuable data in your natural sleep environment.
Right, because we don't sleep in a lab every night, we want to see what's happening at home. Sleep apnea happens when your airway partially or completely blocks while you sleep. This can cause loud snoring, frequent waking, or daytime tiredness. And over time, it affects oxygen levels and your health.
And sleep apnea usually gets worse over time. It can start as small airflow changes called flow limitation, progress to airway resistance, and eventually become mild, moderate, or severe sleep apnea.
Here's something important. People can be healthy at a normal weight and have normal looking teeth or smile, and yet still have sleep apnea because of their airway anatomy. Mouth breathing can make tonsils or turbinates larger, which blocks airflow even more and cause a snowball effect. You might be thinking, I sleep fine. What if my concern is something else?
Even if your main concern is nasal breathing, TMJ pain, crooked teeth, or bite issues, we still screen for sleep apnea. These can all be red flags for a partially blocked airway. Knowing this first helps us plan the right procedures for you, because airway comes first.
If sleep apnea is confirmed, first we try CPAP therapy. Some patients tolerate it well, while others struggle with mask discomfort, pressure issues, or trouble sleeping. Many ask if they can skip CPAP, and unfortunately, the answer is no. Trying CPAP is important for several reasons. It is considered the gold standard treatment for obstructive sleep apnea, and all other treatments we offer are compared to CPAP to ensure effectiveness.
A large portion of our patients do not tolerate CPAP for a variety of reasons. When a patient fails CPAP, the next step is to evaluate for surgery. The main procedure is double jaw surgery, sometimes combined with chin surgery or Rhinoplasty, and nasal surgery as needed.
While waiting for the sleep study results and trialing CPAP, there is other things we can work on at the same time. One of which is we coordinate with an orthodontist. Proper alignment of your teeth is critical. Even small changes in bite can make a big difference. The width of the upper jaw affects your teeth and your nose. The roof of your mouth is the floor of the nose. Sometimes braces or Invisalign can expand the jaw, and sometimes we use a special expander device with small screws to help the bone grow. This is called a MARPE, or a mini screw assisted rapid palatal expander. Most of the time, we can achieve the level of expansion we need with the MARPE device. But sometimes we add precise bone cuts to facilitate bone growth more. When the jaws are out of alignment or overworked, it can cause TMJ pain or clicking. Think of it like if you had legs of different lengths. As you walked, you would develop hip pain over time. It's not the hip's fault, it's the legs. Similarly, it's not necessarily the jaw joint's fault. It could be the way the jaws line up.
If present, we remove impacted wisdom teeth. These sites are where the jaw surgery cuts are made, so proper healing is very important. We like to do this at least 6 weeks before surgery. While a small jaw is likely the reason for impacted wisdom teeth, removing the impacted wisdom teeth does not cause a small jaw or make your jaw smaller. We do not remove wisdom teeth to pull your teeth back or to constrict your arch.
And we always make sure the jaws are in the right position before working on the nose. Think of it like building a house. If the foundation isn't right, everything else is going to be off. For nasal concerns, we may do a nasal endoscopy, which lets us see inside of your nose while awake, or in special cases under sedation, called a DISE, or drug-induced sleep endoscopy. Let's pause here to summarize because this is a lot of information. Our consultation appointments start with understanding your chief complaint, or what is bothering you the most. Then we do a full medical and radiographic assessment. If any concern for sleep disorder breathing exists, we do a sleep test. If positive for obstructive sleep apnea, we trial CPAP.
If there's no sleep apnea and no major bite issues, but nasal breathing is the main concern, we still move on to evaluating the upper jaw width. Remember, the roof of the mouth is the floor of the nose. Sometimes jaw expansion alone improves airflow.
This is why many patients are surprised the workup is similar even if the complaints are different. Face, jaws, teeth, and airway are all connected. Following the same careful pathway allows for us to choose the right treatment in the right order.
For the patients with sleep apnea or jaw misalignment, once orthodontics is ready where the upper jaw is the right width, the teeth are aligned, sleep apnea is confirmed, and CPAP was not tolerated, we do a pre-op planning visit for jaw surgery. We repeat 3D scans and measurements. We take an intraoral digital scan and create a virtual surgical plan to make our custom guides and plates with our biomedical engineers.
While that's being prepared, you get a surgery date and see your primary care doctor for pre-anesthesia clearance and labs. We then meet with you about 2 to 3 weeks before surgery to review your surgical plan, looking at your movements, whether a rhinoplasty or chin would be beneficial to you, your hardware, and go over consents, plus review any concerns by your primary care doctor or that you might have. This allows you to ask any questions and gives us time to modify the plan to make sure we meet your goals. Jaw surgery can fix teeth alignment and facial shape, but it comes with risks. These include swelling, bruising, numbness, sometimes infection. Occasionally, bones may need a second surgery to heal correctly. We expect all patients to have numbness after surgery. Typically, the upper lip and teeth come back in a few weeks, but the lower lip and chin and roof of the mouth can take 1 to 2 years to come back, and this is totally normal and expected. This is not a motor nerve, not how you chew, speak, or talk, just the way that it feels. Almost like persistent Novocaine at the dentist that takes a while to go away. Jaw surgery is typically 1 to 2 hours, and you generally spend 1 night with us before you go home the following morning. Follow-up visits are typically at day 1, 1 week, 3 weeks, 6 weeks, and 3 months after the procedure. Recovery includes some swelling, usually mild pain, and a no-chew diet for 6 weeks. At 3 months, we take a 3D scan to check bone healing.
If you're from out of town, you generally stay with us for 7 days and then you can fly home. After you fly home, you can expect to see us 2 to 3 more times. We are currently seeing patients for consults and follow-ups in many states throughout the country.
If jaw surgery was performed, we reassess the nose at 3 to 6 months. Jaw surgery often improves nasal breathing, but myofunctional therapy and sometimes nasal surgery are needed to optimize it. Here, we may do a repeat sleep study or nasal endoscopy to evaluate our progress. Nasal surgery for breathing or cosmetic concerns is called a septorhinoplasty. If jaw surgery was done or wasn't needed, and the upper jaw is already expanded or didn't require expansion, we can then move on to the nose and nose surgery. The foundation is set, and the jaws and lower airway are in the right position. Nose surgery focuses on breathing first, straightening our crooked septum, opening narrow internal nasal valves, or reducing swelling turbinates. Our goal is to create a clear path for airflow in and out of the nose. Once breathing is optimized, we can also address cosmetic concerns like smoothing a nasal hump or refining a bulbous tip. If jaw surgery wasn't needed, we can add chin surgery with either a genioplasty or chin implant for facial harmony. Waiting until the jaws and airways are correct allows lasting, accurate results. Septorhinoplasty is powerful, but like all other surgeries, it has risks. These include swelling, bruising, bleeding, numbness, and the need for a second procedure. When the whole airway is complete, next we need to do some exercises. Breathing is not just about bones. Your airway is made up of muscles, and those muscles have habits. While surgery and orthodontics puts the bones, cartilage, and teeth in the right position, the muscles still need to be retrained to work properly.
That's where myofunctional therapy comes in. It teaches the tongue, lips, and facial muscles how to rest, swallow, and breathe properly. This supports healing and long-term results. Think of it like physical therapy after an orthopedic surgery. Even if the structure is correct, rehab is needed for proper function. In children, early myofunctional therapy can even influence growth, sometimes preventing the need for future surgery. By combining structure and muscle training, we don't just fix a problem, we create a healthier breathing pattern for the future.
We want to pause here to talk about insurance because it's the #1 question we get asked. Most insurance helps with jaw surgery for 2 main categories. The first, sleep apnea that didn't improve with CPAP. The second is when the bite is very misaligned and chewing is difficult. Insurance often covers nasal surgery when needed to improve breathing because of a crooked septum, swollen tissue, or narrow areas.
Costs depend on your case and plan. We assign a treatment coordinator to review benefits so you know your options before deciding on surgery. Many people don't realize how often airway health is misunderstood or missed, especially in children. Trouble breathing during sleep doesn't always look like snoring. In kids, it can show up as hyperactivity, trouble focusing, mood changes, or being labeled with ADHD. Children as young as 5 or 6 years old can benefit from an airway evaluation. Early intervention can sometimes prevent bigger problems later in life.
Seeing us doesn't always mean surgery. Our goal is to guide growth and function in the healthiest way possible. Adults should also consider a consult if they have chronic mouth breathing, poor sleep, jaw pain, headaches, crowded teeth, or nasal breathing issues, even if previously told everything looks normal. Even if you're only considering cosmetic rhinoplasty or nose surgery with a chin implant, it's worth a conversation with us. We look at the face and airway as a connected system. If your airway health and foundation are correct, we can safely do the cosmetic rhinoplasty and/or chin implant, but in our practice, cosmetic changes are after addressing your health.
We don't just fix crooked septums or remove impacted teeth. Our model is whole person, whole face, focusing on breathing, function, balance, and long-term results, not quick fixes. No patient is too young or old for a consult.
As oral and maxillofacial surgeons specializing in cosmetic and functional facial surgery, we are uniquely trained to evaluate everything at once. We know this process can feel complicated, but at AOS, we guide you every step of the way. While there are other options out there, our approach gives consistent, reliable results with airway health as the top priority.